questions at the end. Um, we're we're working to make these meetings as accessible as possible, and one of the ways that we're trying to tackle this is through using having access to other languages through the closed captioning feature. If you right click on the closed caption box, it should be at the bottom of your screen. A menu will come up, so then click translate into English, and a box will open up at the top of your screen where you can choose what language you would like the capturing translated into. We also have someone here to help translate questions from Spanish speakers if those come up. Before we get started today, we wanted to remind you that this meeting is being recorded and it will be available Friday on the DSPD website under the Individuals and Families tab, and then the Be Informed and Be Involved. Please mute yourself and type any questions into the chat box. I recognize we have a few people on the phone, so at the point we open it for Q&A, you may need to just take yourself off mute if you have a question, because you wouldn't have a way to be typing things in. Our agenda today is going to cover a few things. We'll be going over announcements, staff changes, legislative updates related to caregiver compensation, our person-centered planning training, and then we have the under community resources, the Human Services Research Institute. They're working to engage people as they're completing the long-term services and supports study for disability services and aging services. So we're excited to have them here with us today. For our announcements, DSPD is currently holding a series of work group meetings with families, providers, and support coordinators. They're all being held uniquely so that we can hear each perspective and voice to get feedback about integrating rights restriction data and processes within the person-centered support plan. The work groups have had their initial meeting in October, and each work group will have meetings in November and December, and then they'll be wrapping up in January to finalize the recommendations that are being provided in those work groups, and then that will be reshared and presented to the DHHS to review. We anticipating starting making physical changes in the rights restriction process in U-Steps, UPI, and My-Steps after that point, so that we have a chance for everyone to be collaborating together in that process. And for anyone who needs to know, My-Steps are the interface we have for families and people with disabilities to engage in the case management system within their scope. So, and then I just realized I forgot to let Nadia translate our introduction. So let me give some time to Nadia.
Thank you. La grabación la puede encontrar el próximo viernes en nuestra página del internet. Para verla puede ir a dspd.utah.gov, presione en Individuals and Families, Resources, and Be Informed and Be Involved. Presione Family and Self-Advocate Gathering, donde puede encontrar la grabación de la última reunión, así como reuniones pasadas. Estamos haciendo todo lo posible para tener esta presentación en otros idiomas, pero por ahora solo tenemos disponibles los subtítulos. Si desea usar los subtítulos, puede hacer lo siguiente. Presionen el círculo que tiene 3 puntitos. Presionen la cajita de abajo que tiene las 2 C mayúsculas. Presionen la cajita de la derecha que dice English Caption Settings. Va a salir otra en medio de la pantalla. Presione la opción Translated Captions. Luego presione Spanish y presione la X en la esquina de arriba a la derecha. Y los subtítulos estarán en español cuando alguna persona esté hablando. Si tiene alguna pregunta, en la mano derecha, en la parte de abajo, hay un cuadrado con líneas como si fuera que alguien está hablando. Presiónelo y saldrá una segunda pantalla que dice In-Call Messages, en el cual usted puede escribir su pregunta. En la parte de abajo hay una línea que dice Send a message to everyone. Si escribe su pregunta ahí, la puede hacer en español y yo se la traduzco. Luego presione la flecha para que la podamos ver. También puede hacer preguntas en voz alta, solo presiona el círculo que tiene en la manito. Le haremos saber cuándo puede hablar y no se olvide de presionar el micrófono para que la podamos escuchar. Si desea mandar sus preguntas por correo electrónico antes de la reunión, puede mandarlas a dspdinfo@utah.gov en español. Estaré presente y disponible durante toda la presentación en caso que tengan preguntas. Gracias. Back to you, Angie.
Thank you so much, Nadia. And sorry, I missed that initially.
No worries.
Our next announcement is that in partnership with the University of Utah, the Utah Department of Health and Human Services is interested in learning more about the experience of Utah's caregivers of children and young adults. So postcards to complete a survey called the Raising Utah Children Study have been sent out to random households across the state. If you've received a postcard, please consider filling out the survey to share your experiences. And when you do that, there is a $10 gift card that is sent. So if you have questions, please reach out to Shauna Ayers. We'll go ahead and put her contact information in the chat. We have had some staff changes since our last meeting, so I'll go ahead and let you know what those look like. I mentioned last time that we had our assistant director leave and that we were going to be hiring an assistant director of operations and one of programs. So Dean Whedon has been hired and started as our assistant director of operations. We're really excited to have him on board. He can't be here today. He ended up with a conflicting meeting. But hopefully we'll be able to give him a chance to meet you or for you to meet him next time. And then Marcy Platt is our assistant director of programs, replacing Jamie Withrich. She has been working within DSPD. We're really excited for her interest in this position and all of her experience and talents that she's bringing to it. So we're happy to have those positions filled because they're gonna, right, the purpose of that is to just help us continue to strengthen our system, make sure it's responsive and meeting the needs of people we serve. Scarlett Uda, she's been working on our limited supports waiver and she's moving from our request for services committee to the limited supports waiver as the waiver manager. So we're super excited to have her there. We have Jeremy Kellogg and Elisa Ferguson joining our emergency services management team. This is the team that reviews kind of more crisis situations where our attrition funding is appropriated. One of the things we're doing within that team is making sure that a support coordinator within DSPD works with those people for that first year to help make sure that we're able to get things set up more quickly for them, that it's going smoothly. Hopefully we can be more responsive in adjusting things when their needs are fluctuating just because they're coming out of a crisis. So we're really happy to be able to be addressing that. We have Tim Lewis, who is working with Bruce Walia on our as a division technical writer. They help us develop the rules, our directives, which are our policies and practices. You probably see them present information like at the Disability Advisory Council. Then we have Daniel Ibsen and Emily Williams. They've joined our payment support team. Alex Kiopania, he's in our accounting and budgeting team as a financial manager. We have Jacqueline Sells and Rachel Glad on our RFS team, hired specifically through ARPA funding, and they are parents who have family members on the waiting list. We intentionally wanted to have people with lived experience in this role so that we can have that perspective as we develop processes, as we're working on things, just so they're kind of going through it and we can have that lived experience on our teams. Bridget Allen is also on the team. That's a replacement position, so it's not ARPA funds. Tony Bettino is on our intake team, and Marissa Bowen is on our team that is helping people transition from intermediate care facilities into home and community-based services. So that's been a few changes since the last time we met, and hopefully it helps you know who you might need to connect to if you have some specific questions, and maybe kind of how everything works together. Updates, our legislative updates are related to caregiver compensation. So first of all, just thank you so much to anyone who took the time to review the draft that was sent out to people about the proposal for caregiver compensation. We got close to 500 responses. I think it was 474 on our feedback form. Also, Joey Hanna had held a meeting up front pretty early where we were able to hear people's questions. So thank you very much for that feedback. The public comment ended on October 29th. And now we're going through and reading all of those responses and feedback from that draft program proposal. And this is going to give us a better idea of what changes we may need to make to the draft before the program starts. We have already changed one thing in the draft plan. We said the program would start in December, and we've moved that date back a couple of months. We are now planning to start the new caregiver compensation program on February 1st of 2024. This gives us more time to go through your feedback, consider it, and make any needed changes to that draft plan. If you are in DSPD services and are using the temporary caregiver compensation program, we want to make sure you don't have a gap in services. So we sent instructions to your support coordinators explaining how they can request to extend your caregiver compensation through January 31st. This way you won't have a gap between the old caregiver compensation program and the new one. If you have more questions about this transition period, this transition period between the two programs, please feel free to reach out to your support coordinator. We have received many questions from people, from like families, about the draft plan, and we've drafted some answers to the most frequently asked questions. We have sent that out. We'll also put this link in the chat, and I'll take a minute to review it during the Q&A part of our meeting as well. So we really appreciate the feedback and the questions that we've been receiving. I'm going to now turn some time over to Bryn Peterson and Lisa Wade to talk about person-centered planning.
Thanks, Angie. So we're here talking about person-centered planning today. We're happy to be with you to talk about some skills and share a few tools with you on this. Listed here are the 5 competency domains for staff who facilitate person-centered planning. These are published by a national organization called the National Center on Advancing Person-Centered Practices and Systems. We'll give a link to the booklet so you can look at some of those competencies, but they've also published a plain language version which describes these ideas and competencies in a way that's a little more accessible. We'll give you both links there. We're going to talk about, if you're looking at that document, we're going to talk today about the 3rd competency, which is rights, choice, and control. Excellent. So, and really, we just kind of want to start with a statement for what it means to encourage rights, choice, and control for you or your loved one. It means that the person-centered planning process is based on respect. It means that people can make their own decisions. Sometimes understanding also that sometimes people need help to learn about their rights and find their voice in creating their plan. People in services and families can expect that those leading these discussions, conversations, and then later when this transitions to that direct staff support, they can expect that everyone on the support team will presume competence, that all people have the capacity and a right to participate in the planning process. They believe that all people have the ability to participate, also understanding that some just need a little bit more support to do that participating. Support team leading these meetings and providing that later support is always embracing the concept of dignity of risk. Dignity of risk means that people have the right to fail and learn from their mistakes. And really, unless there's an emergency situation, there should not be limits or restrictions put on a person's freedom or activities, only out of a desire to protect them from their choices. Or again, a limit to those freedoms to make choices only because it's in their best interest. Dignity of risk is allowing the person to make independent decisions, knowing that they are taking on some level of reasonable risk and consequences, either good consequences or bad ones. Next on the list here, the support teams, support team members, again, leading in this person-centered way, keep people informed about their rights in the service system and in the community, including the right to be free from discrimination. Advocacy is at the center of education on rights. It's the chance and opportunity to learn about the history and achievements of the disability and aging advocacy groups that are happening now and have come before. We today are really beneficiaries of those past and present disability advocates. Those advocates pushed for equal opportunities in employment, equal access to full education for all, and making sure communities are accessible to everyone. So those are just a few examples. So continuing with the skills in this competency requires that person-centered facilitators and support teams encourage people to speak up for themselves during the person-centered planning process, especially when preferences are not being honored during that planning and support time. A person-centered approach is providing support in times where there might be conflicts or disagreements and practicing supported decision-making in these situations. Supported decision-making helps the person to make and communicate decisions about their life. We're going to share some resources about how to help do that in a few minutes. This approach to decision-making should be used whether or not the person has a guardian. And it's especially important when considering rights restriction for the person. We want to acknowledge also that a person-centered approach means staff and support teams learn and know what signs of abuse and neglect and mistreatment look like, and that all of us really know who to contact in those situations and how to report. So I'll turn it over to Lisa to talk about some of these tools.
Thank you, Bryn. I am Lisa Wade. I'm on Bryn's team, the Employment Planning and Community Inclusion team. And I'm also a parent of a young adult who receives DSPD services. And I'm happy to be here with you today. So we're going to talk about a couple of tools. One is the tool for exploring decision-making supports. And this tool, which we'll put a link in the chat that you could pull up and look at while we're talking about it, but it identifies areas where a person might need individual supports to make important decisions. This link has 3 decision-making areas. 1, I can decide with no extra support. 2, I need support with my decisions. And 3, I need someone to decide for me. So this tool uses the domains which have been identified by charting the life course with questions in each area. The domains include daily life and employment, healthy living, social and spirituality, safety and security, community living, and advocacy and engagement. And under each of these domains, you'll find questions that are meant to be answered and spark other questions within each domain that are more unique to the person. This tool can inform where a person can make the most independent decisions possible, as well as where the support team can begin creating goals around building self-advocacy. For parents, it can help us to know when to step in and provide support, or when we can step back and let our loved one lead in making the decision. And for individuals who are transitioning to adulthood, this tool can be especially helpful as a parent to know how to prepare them to be as independent as possible in their decision making. So this is an example of some of the questions under the daily life and employment domain. Keep in mind, we all need some supports for some of our decisions. Not many people are completely independent in all of their decision making. So as a reminder, the answer options are: I can do it on my own, I need some support, or I need someone else to make this decision for me. So as you read through these questions, can I make big decisions about money? Do I make everyday purchases? Do I pay my bills on time? Do I keep a budget so I know how much money I have to spend? And then you choose the answer based on how comfortable you are making the decision yourself. So how would you answer those questions? What types of things do you use support for? Do you have trusted people in your life that help you make some of those decisions? And are your supports always people? What about technology? I know I use technology to help support some of my decisions, especially about budgeting, right? I pull out the budgeting app to help me make decisions about money. So supports don't always have to be people. I'm going to switch now to talking about another tool that can help cultivate that competency of rights and choice and control, and it's the employment pathway tool. So as a reminder, all individuals who receive DSPD services between the ages of 14 to 65, which is working age, should have the opportunity for informed consent around employment every year. And the employment pathway tool is where support coordinators can document the options, the experiences, and information, which is informed consent, that a person participated in throughout the plan year, and note their reactions to each activity. Providers are responsible for scheduling the experiences and activities tied to the person's interests. And this is of particular importance for individuals who are not working and have not expressed an interest in doing so. We want to make sure that they understand what work really is and what it could mean for them. The develop section of this tool, and I believe there's a link in the chat for it if I didn't mention that before, but that develop section is a great place to record the activities and experiences an individual wants to explore around employment. It can help identify interests and activities they want to participate in, to help you with scheduling and planning those activities that they can do with staff, or if you're on the wait list, that you can help facilitate for them. So parents can use this tool, whether or not your child is in services, to document interests and then connect them to some possible employment opportunities. So let's talk about the 4 identified pathways in the employment pathway tool. They are pathway A, a person is unemployed and expresses an interest in work. Pathway B, the person is unemployed and expresses they do not want to work right now. Pathway C, the person is working but desires a change. Or pathway D, the person would like to maintain their position and grow in their career. We would expect these pathways to change throughout a person's life. I know they've changed throughout my life. But this is another person-centered planning tool that allows the person to give input and direction, choice, and control over what they want in their life. It helps them communicate their feelings about employment at least yearly with their support coordinator for those in services. But remember, it can be created or updated by individuals and families at any time, especially as interests and situations change. So we hope that these tools will support you in becoming more person-centered and giving choice and control to your loved ones. We are here to help, so please reach out with any questions. Our email will be put in the chat. So thank you so much for your time and letting us share these tools with you. Back to you, Angie.
Thank you, Lisa, and thank you, Bryn. And I hope you guys do reach out if you have questions on really how to make this, implement this, so that we can make sure that services are really meaningful for your family, for you. We want, as we're serving people, we want this to be, we want to help people thrive. And this is one of the mechanisms we're using to try and help that happen. So thank you, Lisa and Bryn. We're going to turn the time over to the Human Services Research Institute, and they're going to be presenting their own slides. So let me see who they have presenting today.
Hey, Angie, that's me.
Hi, Jasmine. Welcome.
Thank you. Let me go ahead and pull up our slides. All right. Just going to check. Is everybody able to see these slides? Okay, I'm seeing nodding. So hi, everybody. My name is Jasmine Hepburn, and I'm here today representing the Utah Long-Term Services and Supports Research Project. I'm the project coordinator in this project, and I work for Human Services Research Institute, or HSRI. So we're here today. We were lucky enough to attend the August meeting, but myself and our project director, Jamie Petner are here today. And just to kind of give a little bit of an update. So we'll dive right in. Okay. So, and maybe I'll actually back up a step and give kind of a refresher about what this project is. So the purpose of this project is to learn from people in services, family members, providers, advocacy organizations, and other community members about what's currently going well and not going well in the service system. So this is a research project where we're also getting a lot of feedback from representatives in the aging and disability spaces in combination with research, and we're making recommendations to the Department of Health and Human Services on how to meet people's wants and needs in a person-centered way, how to structure services, and how to create greater capacity so that DHHS can serve more people and expand individual choice. So that's just kind of a little bit of like an overview of what this project is. So it's a research project where we're doing a lot of engagement and coming up with recommendations. So we had our first meeting of the steering committee for our research project in September, and our steering committee is made up of representatives from the disability and aging networks in Utah. This includes people with lived experience, family members, and representatives from organizations across the state. And the steering committee really helps us to know what it is that we should be focusing on in our research, as well as helping come up with recommendations, and they give us a lot of feedback. So we meet with them every 3 months. So we're preparing for another meeting in December. But we were very excited to hold our first meeting in September. The other update that we have is we are putting together our initial engagement plan, which we're in the process of scheduling. But our initial engagement plan includes interviews with our steering committee. It's also attending meetings like we are today to hear from people, get feedback, ask questions. We're also attending, to name a few others, the Independent Support Coordinator Association meeting, or ISCA, as well as like the DD Council. Those are a few that we're attending soon. We're also planning for what we're calling kind of town hall style open engagement sessions in January. And we're looking at doing those with DD professionals, people in the DD system, including people who are on the wait list and family members. And we'll also have 2 more for aging professionals or professionals in the aging network and people in aging services and family members. So that's kind of an overview of what we're currently planning for our initial engagement. But on that note, we wanted to ask you all a few questions. So the first is, which groups should we connect with to learn about what's currently happening in Utah? And the second is, what channels should we use to outreach for engagement opportunities? So for example, when we say channels, that could be, is there a website that you always go to see what's happening? Or a social media site that you go to? Or does that mean I typically hear about, interviews or engagement through something out in the community, we would really appreciate this kind of feedback because that'll help us make sure that we're hearing from people and connecting with as many people as possible. So I'm going to drop these questions in the chat, and then I'm going to go to our next slide, which has a link to a feedback form. Okay, let's see. Okay, so here are our questions, and here we have a link to a feedback form. I'm also going to drop this link in the chat, but there's a QR code on the right. So if you pull out a phone, you're able to and open up your camera and hover over that black and white square. A little link should pop up and you can click that and go straight to our feedback form. I'm going to drop it in the chat now too. But this is a way that you can respond after the meeting, or you can also, I see somebody has said that the Utah Parent Center. Thank you, Kristen, for that recommendation. We are lucky enough to have some representatives from the Utah Parent Center on our steering committee, but this is a great reminder, and I will definitely take that back to our team. Yeah, we just kind of wanted to have like a little bit of time to get some feedback from everybody. So please feel free to also come off mute if you prefer to just respond verbally, or you're welcome to use the forum or the chat. Oh, okay. And I see a request to have the questions in Spanish, and I'm so sorry that we do not currently have that, but that is something that I will definitely make sure that we do next time.
Jasmine, sorry, I can translate for you if you want to.
Oh, please, thank you. Here, I can go back to the question as well. Here. Oh.
You can put it on the chat if you want.
Okay. All right. Here are the questions again in the chat.
Okay, I'll do that.
Okay. Thank you very much, Nadia.
You're welcome.
All right. All right. Well, okay. And thank you, Camille. I see a recommendation for Sumiko Martinez, the Director of Autism After 21 Utah Project. Okay, wonderful. Thank you so much. I'm going to be collecting this. And then I wanted to just share my contact information as well. Again, I'm the project coordinator here. So my role is that if I can't answer your question, I will do my best to connect you with somebody who can. So I'm going to drop my name and email into the chat. Please feel free if you have any questions about this project or any outreach and engagement ideas or resources, recommendations. We really look forward to hearing from you. And thank you, Angie. I will pass it back to you.
Thank you, Jasmine. And I just want to echo that we are super excited that they are doing this work and this study for us. We think it's going to be so valuable in understanding the needs in our system, any like gaps or changes, or kind of how to best meet the needs of people in Utah. So we're really excited to be learning through this process with them. So we're super excited to have you contracted and working on it. Okay, that has been our presentation. So we're going to go ahead and move over to the question and answer period. We have a few questions that were submitted ahead of time, and we also have our caregiver comp frequently asked questions that we had sent out. So I'll start with the email we sent that had the frequently asked questions, and just go over that to make sure everyone's had a chance to hear those. Answer the questions that were submitted ahead of time, and then we'll go through questions that are coming through this meeting. So thank you all for being here and listening to all of this. The first question that we have under our frequently asked questions was, who is eligible for the ongoing caregiver compensation program? So the ongoing caregiver compensation program will be one of the service options available to those who are receiving services through DSPD and who are enrolled in the Medicaid waiver program. People on the waiting list who receive one-time respite services might also be eligible to participate in the caregiver compensation program. Please talk with your support coordinator or your waiting list case manager if this is something that you're pursuing or interested in or see the need for. The next question is, how will the ongoing caregiver compensation program work and when will it start? And I know we talked about a little bit through this during the presentation. I'm just going to go ahead and reiterate some things. So we released the draft plan with the feedback date by October 29th. And just thank you again for everyone who gave feedback. And now that we have the feedback, we're considering all of that as we work to finalize the caregiver compensation program. Right now, we're planning to have the ongoing program start February 1st, which is a date a couple of months later than we had anticipated in December, just to help make sure we have plenty of time to consider the feedback that was given. The next question is, what will the transition from the temporary to the ongoing program look like? So this new ongoing program will start February 1st, 2024. And if you're currently using caregiver compensation through the temporary program, your support coordinator needs to request an extension of the caregiver compensation through January 31st. And I think we've actually seen most of those already. So, but please talk to your support coordinator if you need more information on that. The next question is, how are the tiers determined? The draft plan outlines 3 tiers that you can be placed in based on the needs of the person in services. Each tier has a different amount of payment the person would receive monthly for providing those caregiving services. They range from tier 1, which is the lowest monthly payment, to tier 3, which is the highest monthly payment. A person's needs will be determined by 2 assessments that we already perform and update annually. One is the Utah Comprehensive Assessment of Needs and Strengths, also called the UCANS, and the other is the Comprehensive Brain Injury Assessment, also often referred to as the CBIA. Along with these assessments, people's medical and behavioral needs will be considered. People in services should already have one of these assessments on file. If your assessment is out of date, please contact your support coordinator. Both these assessments can be updated as needed to make sure that the person's needs are accurately represented. The next question is, can I appeal which tier I'm placed in? Yes, you will have the option to appeal if you disagree with the assessed tier. DSPD is in the process of finalizing the notice of agency action and hearing rights procedures for appeals involving caregiver compensation. And when this process is finalized, we'll make sure we implement it through administrative rule, which also goes out for public comment for people to give input on. The next question is medical treatment definition. What qualifies as a medical treatment? A medical treatment is a course of action or a therapy recommended or prescribed by a licensed healthcare provider to manage a person's medical condition. We do not have a finalized list for what could be included under this definition. Some examples could include intensive allergy treatment, injections, ongoing wound care, the use of trachs, seizures with a treatment duration and seizures. And these would be things with a treatment duration of at least 90 days. If you have specific items that you feel need to be included, we had been soliciting that, so we're hoping to have received that during the public input period. The next question is behavioral treatment definition. What qualifies as a behavioral treatment and who provides the assessment? A behavioral treatment is a treatment that addresses presenting social, emotional, and behavioral health needs of an individual. Assessment and verification of the behavior treatment will need to be conducted by a board-certified behavior analyst. If you have specific items you feel need to be included or excluded, we were soliciting that during the feedback as well. The next question is, how will this work if I have multiple children and services? So families will be able to provide caregiver support to multiple children and services or on the waiting list if they're approved for one-time waiting list support. Each caregiver would be limited in the number of people to whom they could provide caregiving needs, caregiving services based on the intensity of the needs of the person receiving that service. If more people in the family need caregiver support through the caregiver compensation program, a different qualified caregiver would need to provide the care. Our next question is, how could this mix with other services such as respite, and will my budget be reduced? Caregiver compensation is one part of the overall service plan for people in DSPD services. Each person's situation will vary according to their health and safety needs, which means every person's budget is going to look different. A person may need other services like day programs or respite to meet those needs. People in every tier level will be able to request other services as needed. As it is today, it will be based on the needs of that person. Caregiver compensation is not intended to be added onto the support plan a person is currently receiving. Instead, it's a way for the parent or guardian to provide the services that would have otherwise been provided by a different employee or provider. Each request will be reviewed on an individual basis with the goal of making sure the right mix of services is provided to meet the person's health and safety needs, and that they're in the best interest of the individual when considering their care needs and their preferences. Our next question is, have you considered adding more tiers to the system or doing away with the tiers completely? And that is part of what we are soliciting that feedback on, and those are the feedback that we're reviewing right now to help inform us for the next steps of the program. Can I change tiers through the year as my needs change, for instance, moving from the school year into summer? So in the draft plan, the tier level is based on standardized objective criteria that focuses on the person's strengths and needs. Much of the data that will be used to determine the tier level will be pulled either from the Utah Comprehensive Assessment of Needs and Strengths or the Certified Brain Injury Assessment. We don't anticipate that these assessments will vary throughout the year, but if a person's circumstances change enough to require an update on the plans in the middle of a plan cycle, we would want that update to be completed. And in general, the tier will remain the same throughout the year. And the program is not intended to address all the time a caregiver spends caring for their loved one. The next question is, would we only get paid once a month under the draft plan? In most situations, the payment to the family would be once a month. This payment schedule could vary depending on the FMS agency or the provider you use. Our next question is, will this income affect me financially via taxes or other benefits I receive, such as Medicaid, SSI, SNAP, etc.? On this, for information on how this could affect your taxes, please talk to your tax professional. For information on how this could impact your other benefits you receive, please talk to your eligibility worker with the Department of Workforce Services. We have a number here. It's where people can be reached. It's 1-866-435-7414, and we'll put that in the chat if you need that. The last question on our frequently asked questions that was mailed out is, what documentation will I be required to provide and how often? So a person or a family using the self-administered services model will submit a report every month to their fiscal agent and their support coordinator. We have a draft of that was also shared for people to give input on. Under the provider model, the providers will need to provide that monthly summary for all of their caregiver comp services and submit that to the support coordinator. I'll go ahead and get to the questions that came in ahead of this meeting. One is, why do parents that are caregivers 24 hours a day to adults with medically diagnosed permanent mental and physical disabilities have to have a behavior assessment or behavioral plan from a DSPD approved healthcare or behavioral facility before they are approved for Tier 3 caregiver compensation? I choose for my son not to attend a day program because he has been physically and verbally abused. My son also was physically abused by a home caregiver that was taking care of my son during the time I was employed. On this, thank you for your question. We are considering all of these questions and feedback as we work towards a finalized caregiver compensation program. Our next question is, why can't a parent, spouse, caregiver qualify for Tier 2, can't qualify for working 80 hours a week? As I mentioned in the last question, we are reviewing all of this feedback, and when the program is finalized, we will be sharing that. We will let you know what changes we made based on your feedback. So thank you for taking the time to do that. The next question that came in ahead of time is, if moving from out of state with an adult member that is on Social Security, what is the process to transfer services to Utah? Is there a waiting list for an adult member before an adult member is eligible for a day program or respite services? So first, for anything related to Social Security, please reach out to the Social Security Administration. And regarding services for people with disabilities, we do have a waiting list. And disability services do not transfer from state to state. Utah has 2 methods for bringing people into services. And I guess I should preface this with, it always depends on us receiving appropriations to bring additional people into services. People come into services, one, either based on having the highest need, and the other is through limited supports, which is based on lower needs. And the time waiting to come into services varies for people. There are people who have been on the waiting list for an extended period of time. And there are people who, kind of based on the criticality of their need, have been on the waiting list for a very, very short period of time. The next question that came out of today, looks like Jamie Douglas might be ready to answer this one. The question is, can parents get read-only access to our kids' U-Steps? So Jamie, it looks like you are on if you're available.
Yeah, certainly. So right now we do have an online application portal. It's called My Steps. So people can apply for DSPD. If they're on the waiting list, they may be able to view some limited information and update some basic information in their social history. We are working toward allowing individuals in services to have the same access. So that's something that we're working on right now. But if you're currently on the waiting list, we can work to help you get access to that information.
Thank you, Jamie. And Jamie has been a great advocate in helping us move forward so that we can make sure that people with disabilities or family members are able to access information as well. So thank you for that question. And Jamie, thank you for the work you do on that. The next one is, doesn't it make sense to allow a parent to receive 40 hours of caregiver compensation if their child has been accepted through the rigorous DSPD process? The child is over a certain age, for example, 22, and receives no services or few services during the week. The severity of medical and behavioral needs doesn't change the fact that the child needs care and the family needs to survive financially. This was how this program was presented to the legislature. Thank you for that question. Again, like, we have been taking this feedback, and we did present the information for that purpose so that we could be getting feedback. We had shared it with representatives as well, and I understand that people have been reaching out to their representatives with questions or feedback too. And so this is the purpose of getting this input, so that we do make informed decisions, and that we do make sure that, so there are a few factors as we're considering all of this. One is making sure that we're meeting the criteria for the Centers for Medicaid and Medicaid Services. The second is really making sure we're understanding the needs of people in our state, and making sure that we're able to provide the service within the appropriations that was given. So those are all factors that are playing into this, and your feedback helps inform us for like how to really make this the most effective process. So again, thank you for that. And we have been connecting with legislators over this too. We know there are a lot of people invested in making this successful and work for families across our state. So thank you for that. We don't currently have any additional questions, but I'll go ahead and just wait a minute to see if there are any others. You see, we have a comment that says the proposed rule does not take into account the continuing scarcity of care providers in urban areas. So again, thank you for everyone's feedback. Those are all factors that are being considered. And we'll, as we're going through this process, we'll make sure that we're including the feedback that we got today. So thank you for that as well. Okay, sir, our next question is probably one that we can't answer. What's the difference between SSI and SSDI? If you qualify for one, do you qualify for both? Or is it one program or the other? We don't administer or make any Social Security determinations. So you'd really need to be able to reach out to the Social Security Administration for that. That's a great question. I just want to make sure you get it from the right source. We have a couple of additional questions. But I think a lot of this is really good for us to make sure we already, some of this really echoes feedback we have, and but we'll make sure that we're capturing the questions. One is, my concern about the loss of hours of caregiver compensation is that my boy is totally dependent on us, but probably does not meet the medical criteria of tiers 2 and 3. That does not lessen his need for care by me. And the other one is, I see families giving up already on caregiver compensation because of the complicated tier system and are looking for work and trying to find care for their child. Two seemingly impossible tasks. So I appreciate that feedback as well. And I think hopefully many of you know one of the reasons we were looking for a monthly payment process and then needing to make sure we had a way of assessing need and doing that across tiers was based on simplifying the records and the process for families. So this is good feedback for us to hear. So thank you for that.
I have a question and I'm on the phone.
Yeah, please speak up.
Um, um, so I have a child that has a nurse that comes in daily to do some of his medical care. He has like a catheter that goes through his belly button, that goes through his bowels, and we have to make him solution. And it's a very complex care that has to be done daily for him. I'm wondering, come February, am I going to lose that ability to have my nurse come in because of the transition? Like, is there going to be a lapse in my services?
So
Or
a
something like
nursing
that?
service would be separate from caregiver compensation, right? So
We use it as respite. So right now I'm just billing it as respite. So am I going to
okay.
lose my respite and not be able to have my nurse come in and do that?
So I think I hear your question. I guess I'm not sure why. So if you use respite, this wouldn't prevent you from using respite.
So I'll still have my
happens.
respite hours with my caregiver. Like when you guys are trying to figure out the system, are you still going to allow? How do I explain it?
So I feel like this is maybe one of the questions that has come in and we've answered. Like, can you have caregiver compensation and other services?
Mhm.
Yes, that can happen. It's
And
really
those
based on
will
that
be
person's-
available off the bat in February. That'll already be assessed. Does that make sense? Or am I going to be like, hey, you can't come because I don't have respite and I have to get an RFS to get that approved again?
So if it is something that is already in your plan, then it's going to
Mhm.
still in. So if respite is a service in your plan, it's still a service in your plan. But I
Okay,
think
so our
if you reach
services will
out,
stay the
like,
same, but our hours might change. Is that what it is? Like,
so I feel like on it's hard to get into the details of like any individual scenario. I please feel free to reach out directly if you have like, so we can answer any specific question about your scenario. But I think
Yeah.
part of, and I feel like this is probably part of where it's a little bit hard for everyone, is we put out a proposal for a plan, right? We had solicited a lot of feedback, put out this proposal because we wanted to kind of get input on it. And because it's a proposal, we don't have every detail worked out because we need to be able to take all of the feedback that we've had into consideration. And it does vary
Mhm.
across things, right? And so I get where people are, I understand where so many questions are coming from because it isn't finalized, but that is definitely what we're working towards now. And that's also why we went with the February 1st date. It gives us time to take all of this feedback, look at it within the plan, make any modifications, and then share something out that's finalized and gives people time to like get those assessments done, and then get services in place and make sure everything is like, make sure people's needs are still being met. So we want to
Okay.
make sure there's
So that
time.
will kind of be, they'll evaluate before February 1st of what the needs are
Yes. Yeah.
of each individual. Okay.
Yes.
All right. Then I'm not too worried about it, but yeah, that was definitely a concern for me.
Okay. Thank you.
Yeah.
We have a few more questions. Well, I guess one is a statement. It says we would rather have timesheets that document the extraordinary care we're providing rather than the tier system. I think that is great for us to hear. I do want one thing. I do want people to understand that whether it's hourly services or a tier system, we need to have an assessment process. So whether that assessment is determining hours or whether that assessment is determining tiers, we're going to need to have an assessment process that helps us be consistent within families, within our system. Some feedback that we've had, some from families and some from support coordinators, is frustration that right now it's really hard to
Talking about
determine.
those that are giving care to their own child and being paid out of the system, which is reasonable for many.
Yes, so this is specifically about paying a parent or a guardian for providing that care in lieu of a provider or a staff. Yes. Is that what the question was?
I'm sorry, I think I was talking when I
Oh,
shouldn't have been talking.
I'm sorry. I thought you had a question.
No, I didn't. Thank you.
Of course. So what I was saying is that whether it's hourly or whether it is a tier, having an assessment to determine those needs is something that we need to do, but it's also something that we've heard people indicate the need for, so that it isn't, so that people understand what to expect regardless of who your support coordinator is or who you're serving as a support coordinator. But I do appreciate that feedback. I just wanted to make sure that was clear too. Another question is, our experience with UCANs was the assessment didn't capture the needs of the individual. It also has criteria the assessor uses that voids the info gathered during the assessment. It also contains age-related questions, discounting regressions, and developmental delays. I feel this assessment is faulty for determining tier level. That is great feedback. Thank you for sharing that. We do have people who are trained specifically in UCANs. I think it'll be helpful for us to work with them to make sure we're understanding this question, and just making sure we're capturing the things we need to. So thank you for that. The next question is, how do we know if we qualify for the caregiver compensation? Would our caseworker let us know, or do we need to apply in another way? We did the caregiver compensation during COVID, but not currently doing it. So right now, caregiver compensation is one of the services that's available within our system. So it's a supported living service provided by a parent or guardian. So it's an available service right now. Some people are receiving services through a provider model. Some people use the caregiver compensation model. Some families are doing the self-administered services where they hire their staff. So this is a service that's one of them available across services. And then what you're determining with your support coordinator is what's the best way to meet those needs. right? What is the best way to meet the needs of the person receiving services? So the next question is, once the tiers are determined for each individual, how are we going to be notified and before February 1st? So it will be before February 1st because we'll need to be able to implement it by that date. And we haven't finalized how that notification is going to be shared. But we will definitely make sure that as we take the next step and get the program finalized, we'll be sharing how to be doing those assessments, when to get them done by. We'll definitely be working with support coordinators as well. So we don't have every detail worked out, but we will be keeping you in the loop as we move forward. So thank you for that question. Okay, it looks like those were the questions for today. So thank you for coming. I really appreciate that you take the time. We want to be able to use this time to make sure we're communicating with families and that we're hearing from families as well as people with disabilities, because that's so critical to making sure our system is responsive to, right, the end user, to the families and the people who are using it. So thank you for coming. Thank you for listening, and thank you for sharing your thoughts and your feedback. Our next self-advocate and family gathering will be Wednesday, February 7th, 2024. And as a reminder, you can find information about past and upcoming meetings on the DSPD website under the Individuals and Families tab, and then under the Be Informed and Be Involved heading. Also, we have our Disabilities Advisory Council coming up that is open to the public for anyone who's interested in listening. We'll share a link for that in there, and as well as a link for where you can go view any materials, any previous recordings. So thank you all very much for your time and for coming. And I look forward to continuing to work and communicate with you on caregiver compensation as well as the next time we meet. So thank you and have a great day.